Hello, my name is Adrienne Moore. I'm an endometrial cancer survivor and a patient advocate for Black women with endometrial cancer, and you are tuned in according to Portia.
Hello and welcome to the show. My name is Portia Monique, and today I'll be your host. And endometrial cancer is one of the most common gynecological. Is it gynecological?
Gynecologic. Gynecologic.
Gynecologic. Say it again. I'm sorry. Got it. Endometrial cancer is one of the most common gynecologic cancers, yet for Black women, the experience is often more complex, more delayed, and more deadly. Today,
Mm.
we're joined by Adrienne Moore, president of the Endometrial Cancer Action Network for African Americans, to unpack the reality behind the numbers and what every woman needs to know. Welcome
Mm.
to the show, Adrienne Moore.
Thank you very kindly, Portia. I'm glad to be here.
I appreciate you being here as well and getting this very important message out to the masses because as Black women, we need to know the more, the better off we are.
Um,
Now, for you, take us back to the moment where your journey with endometrial cancer began. What were the signs? What led to your diagnosis? And what were the very first decisions that you made immediately after hearing the words?
Great. That's a great question. I can take you back to, let's say, about 2014, Portia, right around the time when the Affordable Health Care Act was enacted. I worked as a manager, ventilator patient manager. I'm a respiratory therapist by trade, and I was working for a small ventilator company, seeing patients throughout the state of Georgia. And at that time, because of I guess, the number of employees he had the option of letting his employees go into the marketplace to get their insurance. Well, yes, the Affordable Health Care Act could be affordable for some people, but for me, a single person with no dependents, that meant a $600 premium after taxes each month. So during the year of 2014 and 2015, I went without insurance. So, and it was during that time I started to notice changes in my period, in the amount of blood, in the consistency, in how often I was getting my period, whether it was missed periods, it was very intimate. So a lot of heavy spotting was going on, and I was spending money out of pocket to go to doctors to ask them what was this all about.
Mhm.
Now, because I had a previous history of ovarian cancer, they would attribute that to that experience, saying maybe I was approaching menopause quicker than I would expect to, or I was
Mhm.
having problems with ovarian cysts, or I was having problem with fibroids. And I appreciated those answers because none of those led back to the fact that I had an ovarian cancer. But again, all I knew was that there's a cancer called ovarian cancer that is in my pelvic region. I get my pap smears every year. And if there was something else wrong with me, of course, these providers with professional knowledge would tell me, but Adrienne, these symptoms could also mean X, Y, or Z. But that's
Mhm.
not something that happened for me, Portia.
I'm sorry to hear that. So, when you heard that you were diagnosed with endometrial cancer, what were some of the first decisions that you made, and what would you suggest? Would you do it the same way, or would you suggest to other Black women to do something different?
Yes, absolutely. Well, one of the first decisions I had to make when I was then diagnosed 2 years after having symptoms. So in 2016, when I was finally diagnosed, one of the first decisions I had to make was to say, concede with I was there was a lot of missed opportunities for me to have caught this diagnosis a lot earlier. It was the first time that any person had ever spoken, any provider had spoken to me about having a biopsy. I even myself being working in the medical field did not know what that meant for me, what that included, having a
Mhm.
biopsy. So the
Mhm.
first decision I had to make was having this biopsy, right? And then that's the way they could detect what was going on in my uterus from
Mhm.
where I was having the most symptoms. So
Mhm.
what I would say first is for women to know what comes with having a endometrial biopsy. because that in itself is a very traumatic and painful experience.
Mm.
There is no screening tool, other screening tool for endometrial cancer. So it is the only way that cancer can be diagnosed.
Now, if you would, in layman's terms, tell us what is endometrial cancer, and then tell us what the difference between that and I believe you said ovarian cancer is as well.
Yes. So, in layman's terms, what I can tell you from my personal professional experience is that endometrial cancer is a cancer of the lining of the uterus. And it is where cancer cells form in that area of the uterus,
Mm-hmm.
which is a little bit outside of the uterus, around the outside of the uterus, in the myometrium area. And then ovarian cancer is cancer of the ovary, which is, of course, a part of our reproductive system. And that cancer was a cancer that was a tumor that was attached to my ovary.
Mm-hmm.
So with that, I had to have my ovary removed, and with endometrial cancer, I had to have my uterus removed.
Were there any physical signs for either cancer?
The physical signs that I had for my ovarian cancer was just that I was bleeding, had a little bit of bleeding during a time when I thought I was pregnant. That was
Mm-hmm.
in 2003. The symptoms that I had now that I know were early signs of my endometrial cancer was the abnormal bleeding around the time that I should be having my period or wasn't having my period, the consistency and changes in my cycle, those things that happen over the course of 2 years. So at that time, I was thinking again, it was associated with my getting older, with my reproductive history, and that was being information for myself was being reinforced by the providers I was seeing. Adrienne, that makes sense that you would have these intermittent bleeding episodes or the spotting in your period or the delay in the time when you're getting your periods because you have this other history. You only have
Mm-hmm.
one ovary. There are some hormonal imbalances could be happening. And those things were very not easily explained away, but I could say, okay, I can wrap my head around that. And
Mm-hmm.
because I didn't have the language to know that there was another cancer that could be involved, that I didn't know to say, well, could it be a uterine or endometrial cancer? I heard about this cancer that has these symptoms. At that time, there wasn't a lot of information that women were being received about uterine cancer, at least to my knowledge. To my research efforts that I did in 2016, I could
Mm-hmm.
not tell a difference between what I was experiencing and what uterine cancer was. But
Mm-hmm.
now that we know, we have to share the information. It is something that mimics the normal behavior of getting older, moving through perimenopause, and then any postmenopausal bleeding could be associated with the endometrial cancer.
Mm-hmm.
That's what we want women to know. You have to pay attention to what's happening with your periods, with your body, outside of the fact of childbearing.
And so you briefly went through some of the symptoms of the endometrial cancer with your cycles and the irregularities with them. But are there any other and or more significant symptoms that we can identify with when it comes to, this endometrial cancer?
We say the biggest factor in knowing or actually having to talk to your doctor about maybe you're being at risk for endometrial cancer is abnormal bleeding, is abnormal discharge, is something that's not normal to you. If you
Mhm.
know that you get your cycles every 28 days, and all of a sudden you're getting cycles at 21 days, and then next time is 30 days, and each time is a change in consistency. That's a change in your body that you should talk
Yeah.
to your doctor about.
Hmm.
And
Hmm.
then from there, you are putting him on or her on notice that you're having these changes. And maybe that would spark something in them to say, oh, well, let me know if you might have other symptoms such as, I don't know, pelvic pain or bleeding, pain with intercourse, pain with, or you're noticing yourself having more swelling, any other changes happening in your body while this is also happening that
Yeah.
can tie back to you might be at risk for this endometrial cancer.
And then, so if I'm going in for regular pap smears, I might be at the age where perimenopause is kicking in, right?
Mhm.
How would I even know? Like you said, you didn't even know or have the language to even ask about this, but how would I know to even get a screening and or a biopsy? Would that be something that I'm concerned about?
Yes. I mean, how would you know if you had
Right,
never heard of uterine or endometrial cancer before? If you
right,
know about ovarian cancer, and you know about cervical cancer, because you know cervical cancer is the screening tool for cervical cancer is a pap smear.
right.
We learn about ovarian cancer because we hear a lot about it commercially. We know
Hmm.
about breast cancer because we hear a lot about it commercially. What have we heard about endometrial uterine cancer commercially that would even trigger for us to ask the questions about what is this uterine or endometrial cancer? There
Right.
could be something in your doctor's office that maybe sets off something in your brain and say, "Oh, let me ask about this because this is a problem I was having for the last 3 months. My period has been coming every other week and it's getting heavier and heavier. That's not normal, is it?" So those are the kind of questions we can ask, but we can only hope to get back the answers from our providers that actually lead them to a mapping of, okay, let's take this one step at a time. Let me look back at what's been happening to you over the past months and then try to triage where we need to go next to find out if maybe this is a cancer you might be at risk for.
It sounds like it should definitely be on our regular screenings. On a, you get pap smears that every year. Maybe that should be a part of the regular screening as well to screen for endometrial cancer.
And I think you can, that screening could just simply include asking questions that would show changes in what's happening with your periods that could maybe lead to an endometrial cancer. Just
Yeah.
asking questions because again, the endometrial cancer biopsy is not something you want to take lightly. You're not going to go into a doctor's office every year and have a biopsy. That's
Right.
not something. And you have to have, reasons for insurance purpose. You have to have a reason for. You can have a pelvic ultrasound, an internal ultrasound that could show changes in the lining of your uterus that make shows it might be having a thickening happening. But again, until you know that this is something you're concerned about enough to research, enough to share with your doctor, provider, and
Mhm.
enough for your provider then to give you back information so y'all can make decisions together about what you should do next. You won't know. You only
Mhm.
know what information is given to you or what information is relevant to the community in which you are in at the
Mhm.
time that you're in it.
So that was a lot.
I'm
And
sorry.
no, no, no. Thank you so much for sharing because it is information that we need to know. And there were some things that even I didn't know. So thank you so much for sharing that. And we'll make sure that we are putting this out so a lot of women can hear and know that this is definitely something that they should be talking about in their annual screenings and or appointments. Now, in terms of you, you are marking 10 years as an endometrial cancer survivor. So,
Yes,
congratulations on
thank
that.
you.
Absolutely. So, what does this milestone represent for you, not just personally, but also for the women that you now advocate for?
Wow, thank you, Portia, for that question. I think this is a milestone that shows that even during the hardest times of cancer treatment, learning you have cancer, learning you have a late stage of cancer, knowing that you might have an increased chance in your mortality, that you become as selfless as you possibly can. So then at that time when I was diagnosed, when I was finished treatment, I realized that this treatment wasn't about me. This journey wasn't about me. I had to share this information with as many women as I could, which
Mhm.
is why I became a patient advocate because I
Mhm.
didn't know. So if I didn't know, there's probably plenty of women out there like myself. So what it marks for me is means this has been 10 years of me doing the work of helping to spread awareness about what endometrial cancer is, who it affects most disproportionately, survival rates, the things we can do to socially support one another during endometrial cancer treatment. And what it means to me is building community enough so that we can start to have regular conversations like the one you and I are having, Portia, that might trigger something in another woman to say, hey, this might be a cancer that I might need to know about. Not
Mhm.
every woman with this cancer, especially not a lot of Black women with this cancer, get to mark a 10-year anniversary of survival. So
Mhm.
mostly I am grateful. I am thankful for the opportunity to have to be able to share my story, share my
Yes.
experience, and then use it to empower other women to take
Yeah.
care of themselves. We want better outcomes, and in order to get there, we have to start talking about it.
Absolutely. Now, we kind of got into this really quickly and we went down the road of ovarian cancer, endometrial cancer, but you survived both, right? So you survived ovarian cancer first, and then later you faced endometrial cancer, which you also survived. How did that second diagnosis shift your relationship with your body as well as with the healthcare system?
Right. Really good question. I think the first time around, my ovarian cancer was caught very early, and I did not have to have an aggressive amount of treatments. So it was like it was something that was happening to me, but I was mostly disconnected with because I just had to do maybe just a little bit to help overcome that, and move on. And when after I was finished my 5-year surveillance, I didn't think about having another reproductive cancer. And if I
Right.
did, it would have been the ovarian cancer. Well, when I learned about an endometrial cancer, well, that was a little bit different. At this time, I was like, okay, why is my body betraying me? These things that are supposed to help to support life outside
Yeah.
of myself are weaponized now against me.
Mm.
First one in my ovary, taking I wasn't able to bring my child to full term because of that, a child to full term because of that cancer. And now here it is, a second cancer that I'm learning about so late stage that it could take my life. We learn as women, we have this womb that bears fruit that serves the population. We are strong women. And what we're supposed to do is we're supposed to procreate, we're supposed to recreate. But I wasn't able to do that. So I did feel the betrayal of my body. It did have a totally different outlook the second time around.
Hmm.
I really felt that, cancer was coming from me. No matter where it was coming from, it was going to get me. It sure took away my first child that I could have, and then took away my ability to have children altogether the second time around. So, what's going to be next?
I'm sorry.
Are you getting emotional?
That's heavy. Yes.
I
Um,
apologize.
I'm so sorry that that happened to you. And just need a second. Ooh, ooh, that's really heavy. Thank you so much for being a patient advocate and being able to share your story with people who need to hear it, right? Especially amongst the Black women, Black community, healthcare, and all of that. And there's also a pattern of Black women not being believed and or taken seriously in medical spaces. What does that dismissal actually look like in real time, and how do we challenge that?
How do we challenge that, Portia? What that dismissal looks like in real time. What you said first, there's dismissal. Because of dismissal, there's delay and denial. And
Mm,
when there's delay and denial, then you have the late stage, more aggressive disease stages of this disease that's harder to cure, which is death, right? That leads to death.
yeah.
Um, how can we challenge that? We got to get ahead of it until we find a screening tool that can help detect whether or not we are more at risk for this cancer, where it can be caught earlier when it's more curable.
Hmm.
The best thing that we have and can arm ourselves with and empower other women with is information.
Yeah.
But these are things you have to advocate for yourself. But if you don't understand the language and you don't know what it is, what questions are you really asking? If you feel a lump in your breast, so ask the doctor about a lump in your breast. There are things that you can't describe that's happening when you're on your period or not on your period. I mean, we can even dismiss discharge that can bloody discharge can be excused away in something that we've done, or maybe we rode our
Yeah.
bike too hard, or maybe
Yeah.
we had sex too hard, or something like it. So many things can cause us to start to doubt our own experiences. You have
Mm.
to believe yourself first in order for anyone else to believe you. So that means walking into your provider's office fully armed with the information that you know that you've been tracking for the last 6 months or however many months, when you said, this is kind of strange for me, for my cycles to be this heavy, or for me to pass clots this big. Let me ask these questions the next time I'm at the doctor. You
Mm-hmm.
go to the doctor, and they say, oh, well, it's normal. When you come back in 3 months, or when you come back in 6 months, let's talk about it then. This is what
Mm-hmm.
happened to me. And I'm going to be very serious here. I don't know how many 3 or 6 months I had left in me, Portia, before my stage 3 cancer became a stage 4 cancer. That would have been
Mm-hmm.
part of the cure, and I wouldn't be here at all. So, in order to combat that, there's not a wait and see in that conversation. There's a what's next in that
Yeah.
conversation
Mm-hmm.
with your provider.
Yes. What's next? It's not a wait and see. It's certainly a what's next. And then you move that conversation forward. Now, you guys, there was a study that was recently did, and I want to talk statistics as well, because 70% of patients within that study said that chemotherapy was almost as burdensome as the disease itself. And when you hear things like that, what does that statistic fail to capture about the lived experience of treatment?
Right. What it fails to capture is that chemotherapy treatment comes with so many side effects that aren't captured with from when you're in front of your doctor. If you're not telling them that you're having neuropathy, or they can see that you're losing your hair, but so many other things, Portia, like the psychosocial effects of having cancer itself, and then coming along with chemotherapy, which might leave you with alopecia, changing the changes in your identity, your ability to be who you are as a sexual human, as a whole human who can run the way you used to run or walk the way you used to walk. I think that what it's capturing is that chemotherapy, though life-saving, can often be debilitating and halting in so many ways, because you have to navigate now your life around this treatment. So we want to talk about within the survey, how can we start to include what our experiences are to help us triage what our treatment can look like, so that we can get the best quality of life during treatment.
Yeah. Yeah.
That's important for a lot of people.
And then the survey also went on to say that 42% of patients felt that they shared decision making equally with their doctor. Why do you think that so many patients feel excluded from their own care?
It's intimidating to talk about a disease little about, that you're just learning about. There's so much research, you can overdo it in so many directions. And I think why people feel excluded is because it's very generalized as
Mm.
opposed to individualized. What their care could look like is different from what my care looked like, or what the
Yeah.
next person's care could look like. And it requires discussion. It requires the doctor sitting down and asking, what's most important to you and your quality of life? How's this going to affect you, Adrienne or Portia, emotionally, financially? Where can we find other support to plug in the areas where chemotherapy is now become the biggest burden, such
Mm-hmm.
as if there's financial support available? I think about one of the most easiest things we can address is the way they want you to eat during chemotherapy treatment, right? But it's like you gotta make sure you stay hydrated, eat maybe a certain type of diet or increase in proteins, but not really fully understanding what people have access to when they get home. What if you only have oodles of noodles that you have access to?
Right.
So where's the support in making sure that women have the right foods, that they have the right transportation, the good
Yeah.
enough transportation to get to and from treatment.
Yeah.
That if they're missing work because they have to spend 4 or 5 hours inside of a infusion center, how are we going to
Yeah.
duplicate or replicate that income from them for them so they can still support their families?
And let's stay there for a second because I do want to talk about patient advocacy as well as patient empowerment because as you've said, your experience has changed the way that you approach your care. You became more vocal, more informed, and now you're the president of this organization. What are the first three questions that every woman should ask after a diagnosis?
What exactly is endometrial cancer? So, what is endometrial cancer first? Because I'm sure you don't know.
Mm-hmm.
And explain it to me and what it means for me, my particular stage, grade of cancer. That's maybe the first question. And then what are my treatment options? Give me all of my options. And so I can see how they best fit into my life. Do I have the agency to help see what my treatment should look like, to help determine what my treatment should look like? And
Mm-hmm.
the last question that they should be asking is, how much access am I going to be given to support? So when I need it, because we're all going to need, we all, every person diagnosed with a cancer in their life will need support of some
Yeah.
kind.
Yeah.
And I think to take for granted that that is available to each and every person is doing a disservice to humanity.
Yeah. Excellent answers. Now, because we know, especially being in those doctors' rooms, it can be intimidating, and sometimes we just don't hear what what the doctors are saying or the next word out of their mouths after they say you
Yeah.
are diagnosed with, right? So for some of the women who may feel intimidated and or overwhelmed in these type of medical settings, how do they begin to advocate for themselves without feeling dismissed and or rushed and or overwhelmed with the entire thing?
I could say two things can happen. When you're first diagnosed, I think you should always be given the space to digest what you've just heard. We should not move from a you're diagnosed to immediately into, and here's what we're going to do. How about you're diagnosed? And if you're there by yourself, I want you to come back with someone who can help us navigate this conversation so that you feel you have shared decision making power in what we're going to do next.
Mhm, mhm.
This is an opportunity for providers to bring patients into their care so that they're more invested in completing it. When you feel as if, again, the burden of cancer treatment is heavier than the burden of having the disease itself, you might be willing to roll a dice and not complete treatment, which would be worse. We want to encourage women to complete treatment. In order to do so, we want to be able to let them know you have power here. You have power here. And what you don't know, I will give you what you need so that you can help to make better decisions for yourself and for your family and for your support system.
Yeah. And as we wrap up this interview, I just want to say that this has been an excellent chance for us to learn more about what endometrial cancer is, how to advocate for ourselves, and just really learning through the journey that you've been through. So I greatly appreciate your time and your candidness and your transparency in this process for you as well. A couple of questions before we get out of here, but I do want to know about survivorship, right? Because healing, life after diagnosis, legacy, because there is life after diagnosis, and you're a living part of that. So you're a living testament to that. Now, survivorship is often talked about as a finish line, something to achieve,
Right.
something to get to, but it's really a new chapter. What does life after cancer look like for you today?
Life after cancer looks like me supporting the women of Ikana, other Black endometrial cancer survivors through their journey, and helping them to get to the right kind of care, to help them to be a part of opportunities like the EC survey that we that we participated in here, to help us feel more informed about our treatment options. Because yes, cancer is done, we're done with cancer treatment. That doesn't mean our cancer experience is done with us. Many of us live with long-term side effects that need to be addressed through physical support, psychosocial support. You know, we need mental health support as well, because it is a very traumatic experience to have to go through. And yes, we rang a bell, but that doesn't mean that our bodies immediately went back to who they reverted back to who they were before we were diagnosed.
Mhm.
So really what it should entail is a treatment plan for your post-cancer life. Now, here, let's connect you with people who can help you live a more healthier life here out. A nutritionist, a physical therapist, a mental health therapist, a community of people who have experienced the same things you have, people who are your peers that you feel comfortable with talking with, and that can also help you with the information that you need to share with your doctors. Because again, we're still in surveillance. 5 years, so 6 months surveillance, 5 years surveillance, 10 months, we're still getting pelvic exams. So there's still a lot of information we need to be sharing with one another, Portia, outside of once after we ring the bell, once we finish that treatment. So that's what I would say. It's never really over. When you become an advocate, you have invested your life into sharing this knowledge, and that's what I'm going to continue to do.
Well, we certainly appreciate it and, bring into life the work that you do through ECANA, the Endometrial Cancer Action Network for African Americans. Stellar. It is something to be commended for. So thank you so much. Last question. And I would love to come back and do this again because this is so informative and there's not a lot of conversations being had on this. But last question for you for now. If one woman watching this interview walks away and advocates for herself differently, what do you hope she does next?
Well, first, what I hope she does next is to learn more about what endometrial cancer is and see if it aligns with something she might be experiencing. And then look for support in how to bring that information to her provider early enough so that she gets intervention early enough. So she's getting diagnosed if she's diagnosed or if she has this cancer at an earlier stage. So treatment won't be such a burden on her as what we found in this EC survey. So much so that that 2 out of 5 of women would prefer not to have chemotherapy again. So we want to try to be as, what am I going to say, forward focused as possible when it comes to arming people with the right information. And you're only going to get that through shared experiences.
Mhm.
And that's why this EC survey was so important, because it talks about what mattered to women going through endometrial cancer treatment, what mattered to them the most, and where they felt that they weren't heard.
Where do we find more information? How do we find out the results of the survey? And then where do we learn more information about Ikana, the work that you do, and how do we follow all of those great things?
Great. The EC survey was just in a press release, and I don't want to quote here, but I believe you received the press release for the EC
Yes,
survey. Connor was a part of. We were
yes.
also a part of many other advocacy organizations that took part in this survey, and it was because of all the complexities of these many groups that we were able to get as much rich information that we did receive. So I would first go there. So then, and again, it is about just learning and arming yourself with as much information as you can. And
Yeah.
at Ecana, which is www.ecanawomen.org, we are a group of Black endometrial cancer survivors, specifically here to support newly diagnosed persons. You would not believe that we have women coming to us all the time saying, I had never heard of endometrial, still in 2020, the year we're in, the year of our
126.
Lord 2026.
Yeah.
10 years later, still come. I never heard of endometrial cancer before. And the only thing that says to me, Portia, is I'm not talking loud enough. If they haven't heard of endometrial cancer before as a Black woman, then I'm not talking loud enough. And we're not spreading this far and wide enough.
Well, thank you so much for your time and your expertise. And this conversation is certainly a reminder that information is power, but advocacy is also survival. And if something doesn't feel right, ladies, you ask questions, you seek answers, and you never shrink where your life is on the line. For more conversations that center your health, your voice, and your excellence, stay with us. Until next time, I'm your host, Portia Monique. Thank you so much for tuning in.